From 9 a.m. to 2:30 p.m., President Uhuru Kenyatta and the National Security Council engaged experts in the health sector on the day's all-important question, to reopen the country or not. Today's marathon session, a continuation of yesterday's 5-hour Security Council meeting, as the government juggles the lever, saving the economy from total collapse or saving lives.
Those who want to open are right, and those opposed to opening are also right. And this clash of two rights placed us on the horns of dilemma.
The rising number of infections working against the push for easing of containment measures that have forced millions of Kenyans to stay home, with severe consequences on their economic well-being. So far, 2,600 COVID-19 cases have been confirmed, with 83 people losing their lives to the pandemic.
Lakini ni mjinga ambaye hasikizi kutoka wataalamu wake. Wataalamu wetu wametuambia kufungua ni makosa. Wataalamu wetu wametuambia kufungua ni kuhatarisha maisha ya Wakenya. Wametuambia ya kwamba kufungua tukifikiria tuwasaidia uchumi, mwishowe ni uchumi tutakuwa tunaharibu.
Any decision to return the country to normalcy premised on 3 irreducible minimums. 1, that the infections must be contained and the number of deaths reduced, and 2, a healthcare system that would sufficiently handle a spike in infections, and lastly, capacity for surveillance and contact tracing.
Have the cases, as I have said, of infections taken a downward turn, for instance? The answer is definitely no. We are seeing an increase. Have we met the second minimum of prepared health systems with isolation? Again, as I said, the answer is no.
The government also grappled with likely scenarios should it relax the containment measures in phases.
According to the experts behind me here, relaxing interventions by 20% would lead to 200,000 infections and 30,000 deaths by December of 2020. If we relax the interventions by 40%, the infections will peak in November with 300,000 infections and 40,000 deaths. If we were to go even further and relax them by 60%, the pandemic will peak in October with 450,000 infections and 45,000 deaths.
Though county governments have been allocated 5 billion shillings to beef up their capacity to handle the COVID-19 pandemic, their state of preparedness remains way below the capacity to handle multiple number of patients, particularly those in need of critical care. Governors will converge at State House Nairobi on Wednesday to deliberate on these critical questions.
Tunataka tukubaliane na wao ni mikakati gani wataweka, na tunasema ukitaka county tufungue lazima uwe na a minimum capacity ya vitanda 300 zile ambazo zaweza kutumika ugonjwa ukipanda katika county yako. Siaya County has only a 10-bed isolation facility, and already they have admitted 9 COVID patients from only 1 incident. Similarly, Busia County has a 34-bed isolation facility, and 2 days ago, that facility was full.
Many expected the president to ease restriction on movement into and out of Nairobi, Mombasa, Kwale, Kilifi and Mandera. Though Kwale and Kilifi counties have exited the list of red zones, Nairobi remains the coronavirus epicenter, closely followed by Mombasa and Mandera.
Kwa sababu haja yetu ni kuhakikisha ya kwamba hatutoi ugonjwa kaunti moja kuupeleka kaunti ingine.
But the question of sustenance for millions of Kenyans who have lost their jobs, suffered pay cuts or lost their businesses remains key. The number of tenants unable to pay rent rising.
I continue to call upon all Kenyans, particularly landlords and employers, to put people before profits during these testing times.
Not yet uhuru, according to President Kenyatta. Kenyans will have to make do with another 30 days of stringent measures. Hopefully by then, the country will have turned a corner as efforts to contain the virus and flatten the curve continue. Francis Gachuri, Citizen TV, State House,